An annual cardiology conference wrapped up today in San Diego. Some of the things discussed: a new class of cholesterol drugs that may reduce the risk of heart attacks and strokes, and new recommendations about cardiac stress tests that may surprise you. Dr. John LaPook is here with the details. So, Dr. LaPook, tell us more about this medication. How does it work with the cholesterol?
Well, it's an injection, and it's given once or twice a month. And then these patients still take the standard cholesterol-lowering drugs like statins. But on top of that, this new drug further lowers their bad cholesterol, their LDL, by 60%. That is a ton. It's a staggering number.
Yeah, that must be pretty astounding.
So the question is, does it further lower cardiovascular effects and problems? And it seems to. At about a year, it lowers the risk of heart attack, of stroke, and other cardiovascular events by about 50%. Now, that's great for a year. We need longer-term studies, and there was a little bit of an increased risk of cognitive side effects like confusion. So,
how concerning is that, though?
Well, you know, I think it's early, and we need to have further studies, and that is, in fact, already underway. So for now, everybody's kind of excited, they're pumped, and in the editorial about this talks about it being useful for people who are at higher risk of cardiovascular problems. For example, they've already had a heart attack, or they have a known anginal syndrome, in whom the statins, for example, are not good enough.
All right, let's talk about this other topic, a little bit about this new heart recommendation that is out. The American College of Physicians are recommending doctors no longer give cardiac screenings to people who are either low risk or relatively healthy. Why?
Yeah, this is near and dear to my heart because I am an internist. This directly affects me. We are the gatekeepers for people who come in, and I have to make the decision, if you see me, should I give you any kind of cardiac screening? And what the organization is saying is, if you look at the literature here and you look at the studies, if people are at low risk, the benefits of doing things like electrocardiograms, stress testing, and cardiac imaging, they don't outweigh the risks.
And so who should get these tests? I mean, you know, a lot of people will think it doesn't seem like a bad thing to necessarily get tested.
It doesn't seem like a bad thing because people say, oh, I just want to do it just to know. But there are some bad things that can happen. For example, you can get false positives. So the test looks like it's abnormal, but the person really is perfectly fine. Now that can lead to unnecessary further testing, unnecessary radiation. And it's not just a matter of increased cost and increased inconvenience, but they can have side effects. You can end up having a stress test that's abnormal, and then you end up going to the next step. Maybe you get a cardiac cath, and during the cardiac cath, which is more invasive, you could have a complication. So these are things that people really have to take into account. Now, the internist, you know, this is a classic example where you have a rubbing up, a friction between evidence-based medicine, which everybody's talking about now, and me as a person and as an internist thinking, my worst nightmare is for this patient to drop dead, to have something that I could possibly have prevented. And I think that's what you're seeing, you know, that's a lot of what's going on here, at least with me when I'm thinking about whether or not to do a test.
I mean, is that why doctors give otherwise, you know, healthy, low-risk patients these screenings?
For me, you know, I have nothing to gain by doing it, so I refer somebody to a cardiologist. But of course, there has been an argument made that when cardiologists see somebody, or if you're an internist and a cardiologist, if you're referring the person to yourself, you could make money from doing, for example, a stress echo in somebody who is also your internal medicine patient. But I think, you know, at the end of the day, you really have to go based on science. You can't just go always on your intuition as a doctor, although it's very tempting to do that. You know, the hairs on the back of your neck raise up and you go, okay, I'm going to do this test. But I have to tell you, I've been a doctor now for 34 years, and I have 35 years now. I have seen side effects from doing these tests. You start off, you know, with tiny little abnormality. Next thing you know, you have a side effect.
Wow, never realized that. All right, very interesting. Dr. John LaPook, thank you.
Great to be here.